Right now, this very moment, your feet might be warning you about your heart. And here's the shocking part. Nearly 90% of adults miss these early warnings. If your feet ever feel too cold, your shoes tighten by noon, or your ankles swell even a little, don't scroll away. These could be the first whispers of something far more serious. Disclaimer: this video is for educational purposes only and is not medical advice. Please consult a qualified healthcare professional for personal guidance. Right now, while you're sitting there watching, your feet and ankles may be trying to send your heart a message most people shrug off as just getting older. Maybe your shoes feel tighter by lunchtime. Maybe your feet stay cold even with warm, cozy socks. Or maybe you've noticed a little swelling around the ankles and thought, it's probably the weather, or I just stood too long today. But here's the uncomfortable truth. Heart failure whispers before it ever shouts. It rarely starts with dramatic chest pain like the movies. For many adults over 55, the very first clues show up at the bottom of the body because gravity pulls fluid downward and your feet are the farthest point from your heart. In the U.S., nearly 6.7 million adults live with heart failure, according to the CDC, and that number keeps rising. The scariest part? Most people miss the early signs until the situation becomes urgent. But before we go further, I want you to hear this clearly. This video is not meant to scare you. It's meant to protect you. Because when heart failure is detected early, doctors have so many more options: medications, lifestyle adjustments, monitoring strategies, things that can help you breathe easier, move better, and stay independent for years longer. Today, we'll go through 12 early warning signs that appear in the legs and feet, including one nighttime symptom that almost nobody connects to the heart. And along the way, I'll share simple, doctor-style checks you can do right at home, plus practical habits recommended by organizations like the American Heart Association and the Mayo Clinic. So you know when to watch, when to call, and when to get help fast. So let's begin with a symptom that sounds harmless, but often isn't. Symptom number 1, cold feet that never warm up. Let me ask you something simple. When your feet feel cold, do they warm up after walking around the house? After a warm shower? After putting on thicker socks? Because normal cold feet, from room temperature, stress, or circulation changes, usually warm up once your body gets moving. But when your heart is struggling, the story looks different. Here's why. Heart failure means the heart isn't pumping as strongly as it should. When that happens, your body goes into a kind of survival mode. It prioritizes blood flow to your brain, lungs, and kidneys, the organs that keep you alive. Your hands and feet get pushed to the bottom of the list. That's when people start noticing cold feet that just never feel normal, even when the room is warm. Cold feet can also come from conditions like diabetes, high blood pressure, or a history of smoking, all of which reduce blood flow. And according to the Cleveland Clinic, frequent cold feet are a sign worth discussing with your clinician. Quick at-home check. Tonight, ask yourself, is it both feet? Does it happen most evenings? Does walking help, or do they stay cold no matter what? And one important safety note: if one foot suddenly becomes cold, pale, bluish, or numb, don't wait. That can be a sign of blocked circulation and requires urgent care. Now let's move to a symptom you can test in just 10 seconds. A symptom doctors rely on every single day. Symptom number 2, pitting edema. The finger test doctors use. Most people experience some swelling in their ankles at some point, after standing all day, sitting on a long flight, or during hot weather. This kind of swelling often goes away overnight, but there's a type of swelling that makes doctors stop and pay attention: pitting edema. And you can check for it right now. Here's how doctors do it. Press your thumb firmly into the swollen area around your ankle or shin. Hold for 10 seconds, then release. If the skin bounces back immediately, that's less concerning. But if it leaves a deep dent, one that lingers for several seconds, that's pitting edema, and it changes the conversation completely. According to the American Heart Association, pitting edema often occurs when the heart, especially the right side, can't pump blood forward effectively. Blood backs up in the veins, pressure builds, and fluid leaks into the surrounding tissues. Gravity pulls that fluid downward, so the ankles and shins become the first collection points. The Mayo Clinic reminds us that this isn't a cosmetic issue. It reflects how saturated the tissues have become and how hard the heart is working to keep up. Think of your veins like highways. When traffic moves smoothly, blood flows easily. But when the heart weakens, traffic jams form. Fluid spills into the shoulders of the road, your tissues. Signs that matter. Swelling worse at the end of the day. Deep sock or shoe marks. Ankles normal in the morning, but tight by evening. Light movement, elevating the legs, and reducing salt can help mild swelling. But persistent pitting edema deserves medical evaluation. Now, let's talk about a symptom that almost everyone mistakes for being out of shape. But research shows it's much more complicated. Symptom number 3, leg weakness that feels out of proportion. Have you ever thought, why do my legs feel so weak today? I didn't even do that much. People often chalk this up to aging, arthritis, or lack of exercise. But doctors who treat heart failure know something important. Leg weakness can be one of the earliest signals of heart trouble. Research published in Circulation. Heart failure shows that people with chronic heart failure often develop real, measurable weakness in the leg muscles, not just end-of-day tiredness. Your legs are home to some of the largest, hardest-working muscles in your body. They need steady oxygen to function well. When the heart can't pump efficiently, these muscles feel it first. Some studies show that the muscle fibers actually lose proteins that help them contract. That's why once easy activities, like climbing stairs, standing from a chair, or walking through the grocery store, can suddenly feel overwhelming. Doctors at the Cleveland Clinic describe this as weakness out of proportion to your activity. At-home self-check. Do your legs feel heavy or shaky after light movement? Do you need to rest more often than before? Do your legs tire faster than your arms? Early intervention helps. Light walking, gentle strength exercises, and movement therapy can preserve muscle strength. But sudden or rapidly worsening leg weakness is a sign the heart may not be keeping up. Symptom number 4, rapid weight gain that isn't fat. Have you ever stepped on the scale and thought, there is no way I ate enough to gain that much? If your weight jumps 5, 8, or even 10 pounds in a few days, especially with swelling or tight shoes, doctors don't think of calories, they think of fluid. According to the Mayo Clinic and the American Heart Association, sudden weight gain is one of the clearest signs that the heart is struggling with fluid management. When the heart can't pump efficiently, blood flow slows, kidney signals get confused, and the body starts retaining salt and water. Some patients gain 10 to 15 pounds in a single week, almost entirely from fluid. Why it pools in the lower body? Gravity. That extra fluid settles downward into your legs, calves, and ankles. You might notice in tight calves, deep sock marks, shoes that no longer fit comfortably. Cardiologists often recommend daily morning weigh-ins. Patterns matter more than single readings. Call your provider if you gain 2 to 3 pounds overnight or 5 pounds in a week, because that's a sign your heart's fluid system is off balance. Symptom number 5, blue or dusky feet. If you look down and your feet or toes appear bluish, purplish, or grayish, that's called cyanosis. It's a signal, one of the clearest, that the tissues aren't getting enough oxygen. Healthy blood is bright red. Low oxygen blood is much darker, and that darker color can show through your skin. Cyanosis is particularly concerning when it persists all day, it worsens when sitting or standing, it improves slightly when legs are elevated. This isn't a cosmetic issue. It's your body saying, we're not getting enough oxygen. Symptom number 6, ankle swelling that doesn't go away. Ankle swelling is something many people over 55 get used to. By the end of the day, socks leave deep marks, shoes feel snug, and the skin around the ankles looks puffier than it did in the morning. Most people shrug it off. It's just aging. It's just standing too long. It's just the heat. But cardiologists think differently. In heart failure, ankle swelling is rarely a one-time thing. It's persistent, predictable, progressive. Here's what's happening inside your body. When the heart weakens, it struggles to push blood forward. Blood begins to back up in the veins, much like cars piling up after a highway accident. As pressure builds, fluid is pushed out of the blood vessels and into the surrounding tissues. And because gravity never takes a day off, that fluid sinks to the lowest point, your ankles. A major study published in the Journal of the American College of Cardiology found that ankle swelling is not only one of the earliest signs of heart failure, it's also one of the most reliable indicators of worsening heart function. The difference between ordinary swelling and heart-related swelling. Ordinary swelling improves after a night of rest. Heart-related swelling comes back every day. It gets worse as the day goes on. It may leave a dent when pressed, pitting edema. People often describe the same pattern. Morning, almost normal. Evening, tight, heavy, swollen. If ankle swelling is new, worsening, or paired with shortness of breath or weight gain, it's time to call a healthcare professional. But now, let's talk about something even more subtle, a symptom many people ignore for weeks or months until it becomes a real problem. Symptom number 7, slow healing wounds on the feet or legs. Picture this. You get a small cut on your shin, a scrape on your foot, a blister from shoes that rubbed the wrong way. Normally, it should heal in about a week or two, but instead, it lingers, week after week, sometimes months. This isn't just about getting older, it's about blood flow. Research highlighted in JAMA and the National Institutes of Health shows that delayed wound healing in people with heart failure is strongly linked to low oxygen delivery and sluggish circulation. Healing requires several things: oxygen, nutrients, immune cells, healthy blood flow. When the heart can't pump well, that delivery system breaks down, especially in the feet and lower legs. Warning signs doctors take seriously: a wound that doesn't improve after 2 to 3 weeks, pale, bluish, or swollen skin around the wound, redness spreading outward, drainage, tenderness, or worsening pain. Simple daily habit. Check your feet in good lighting every evening, especially if you have diabetes, numbness, swelling, or varicose veins. Slow healing wounds are your body's way of saying, our circulation is not keeping up. And now, let's talk about a symptom that makes many people stop walking long before they want to. Symptom number 8, leg pain or cramping while walking. Have you ever gone for a walk, maybe to the mailbox or around the block, and suddenly felt a tight, cramping pain in your calves? You stop. You rest. The pain fades. But then it comes right back when you start walking again. Doctors call this claudication. And while many think it's just age, it's often a sign that your legs aren't getting the blood they need. According to data from the Cleveland Clinic and studies in the Journal of Cardiac Failure, people with heart failure experience this because their heart simply can't deliver enough oxygen-rich blood during even mild activity. Your leg muscles are oxygen hungry. The moment you start walking, they need more. If the heart doesn't supply it, muscles send an unmistakable message: pain, cramping, burning. At first, this happens only on long walks or uphill climbs. Over time, the distance gets shorter. Eventually, even walking across the room can trigger discomfort. A hopeful note: gentle movement, done consistently and safely, can help maintain circulation. Many cardiologists encourage light, regular walking, guided by your healthcare provider. But worsening leg pain with activity is not something to push through. It's a sign your muscles aren't getting the oxygen they need. Now, let's talk about a symptom that shows up at night and disrupts sleep in a way few people ever connect to the heart. Symptom number 9, restless, uncomfortable legs at night. You lie down ready to sleep, but your legs have a different plan. They feel restless, tingly, crawling, burning, or impossible to keep still. You move them. It feels better for a moment. Then the sensation returns. Studies show that 70 to 80% of people with heart failure experience nighttime leg discomfort, often without understanding why. Here's the simple explanation. During the day, gravity pulls excess fluid down into the legs. At night, when you lie flat, that fluid shifts upward toward the core, heart, and lungs. This change affects nerves and pressure in the legs, triggering uncomfortable sensations that interrupt sleep. It's one of the most overlooked heart-related symptoms. Tips that may help: Elevate legs earlier in the evening, not right before bed. Stretch calves or rotate ankles. Limit salty foods at dinner. Avoid large amounts of fluids late at night. But if restless legs are new, or you also notice swelling, tightness, or shortness of breath, it's important to talk with your doctor. Now, let's move to a sign that many people dismiss as just veins, when it's actually tied to heart pressure. Symptom number 10. Varicose veins that suddenly get worse. Varicose veins have a reputation for being cosmetic or for running in families. But here's what vascular specialists know. When varicose veins suddenly worsen or appear quickly, it can reflect rising pressure inside the circulatory system. Heart failure and poor venous return can accelerate vein problems dramatically. Here's why. Veins rely on one-way valves to push blood upward toward the heart. When pressure increases because the heart is weak, the blood begins to flow backward. The veins swell, twist, and bulge. Warning signs. New varicose veins appearing within months, existing veins getting larger or more painful, heaviness, burning, or throbbing in the legs. Symptoms worse at the end of the day. Gentle walking helps activate the calf muscles, which act as a natural pump to move blood upward. But rapid vein changes should never be ignored. We're nearing the final stretch. Just 2 more signals to go, and these next ones often appear before people notice anything is wrong with their heart. Symptom number 11, shiny, tight, or fragile skin on the lower legs. This next sign is subtle, but once you know what to look for, it's hard to unsee. Take a moment and look at the skin on your lower legs. Does it look unusually shiny, stretched, smoother than the skin on the rest of your body? Or does it feel thin and fragile, almost tight, like it's being pulled from underneath? Doctors don't view this as a skin issue. They view it as a fluid issue. According to heart failure specialists and clinical descriptions in heart and lung, chronic fluid buildup doesn't just cause swelling. It changes the very structure of the skin. Here's what happens. Healthy skin has tiny folds, pores, and texture that scatter light naturally. But when fluid accumulates beneath the skin, it stretches those tiny structures flat, kind of like inflating a balloon. The result? Skin that looks smooth, shiny, and almost plastic-like. Over time, continued stretching can thin the skin, reduce elasticity, make bruises more common, increase the risk of tears or infections. This appearance is a visual clue that fluid overload has been happening for a while. Doctors often connect shiny skin with other symptoms like daily ankle swelling, rapid weight gain, pitting edema, varicose veins. A simple protective habit. Moisturize daily and treat your skin gently. Avoid harsh scrubbing or strong soaps. But remember, treating the skin doesn't fix the underlying issue. If you're noticing shiny, tight skin that keeps returning, your heart may be struggling to maintain proper fluid balance. Now let's talk about the final symptom, one that affects balance, safety, and independence, and often goes overlooked until it becomes dangerous. Symptom number 12, numbness or tingling in the feet. If your feet frequently feel numb, tingly, prickly, or like they're falling asleep, and those sensations are becoming more persistent, doctors pay close attention. Many people assume this is neuropathy from aging or diabetes. And yes, those are common causes. But in heart failure, numbness and tingling come from 2 overlapping problems. Problem 1, pressure. When fluid builds up in the feet and lower legs, the tissues swell. That swelling compresses the small nerves responsible for sensation. Nerves under pressure don't send signals properly. This causes tingling, pins and needles, burning, sudden zaps, or complete numbness. Problem 2. Low oxygen nerves need oxygen just as much as muscles do. When circulation slows and oxygen delivery drops, nerves begin to misfire. It's like static in a phone line. The brain receives scrambled signals. People often describe it as walking on cotton, feet buzzing, hot spots, or simply, I can't feel my feet. When this progresses, it affects balance, increases fall risk, and makes injuries more likely, because you may not feel cuts, blisters, or pressure points. Safety tip doctors strongly recommend: wear well-fitted, supportive shoes and check your feet daily for redness, blisters, color changes, or wounds, especially if sensation is reduced. Numbness or tingling that becomes frequent or persistent is a sign your circulation and nerves need professional evaluation. Now, you've heard all 12 signs. Let's bring everything together and talk about what this means for you. The big takeaways. What your feet are trying to tell you. Let's pause for a moment. What we've covered today isn't about memorizing medical terms or analyzing every little sensation. It's about listening to your body, especially your feet and legs, because they often speak up long before the heart does. Here are the major points to remember. 1. Persistent swelling, coldness, discoloration, or numbness are not just aging. They're signs that circulation and fluid balance may not be working properly. 2. Rapid weight gain is often fluid, not fat. This is one of the most important early warning signs that your heart is under stress. 3. Pain, weakness, or cramping while walking means your muscles aren't getting enough oxygen. That's a circulation issue, often tied to the heart. 4. Slow healing wounds and fragile skin are signs your tissues aren't receiving the fuel they need. 5. Restless legs at night can reflect fluid shifting back into the body and affecting nerves. Individually, each sign may seem small, but together they create a pattern doctors take very seriously. And here's the hopeful truth. You can't stop aging, but you can slow decline. You can protect your independence. You can improve your quality of life dramatically when early signs of heart stress are recognized and addressed. Today, modern medicine offers more tools than ever. Targeted medications, nutrition strategies, supervised exercise plans, and at-home monitoring approaches that help millions of people live long, active lives even after a heart failure diagnosis. But awareness comes first, and you've already taken that step. If even one of these signs sounded familiar, don't ignore it. Your heart is worth paying attention to, and your future self will thank you. If this video helped you understand your body better, please tap like, subscribe for more doctor-style calming health guidance, and comment below. Which sign surprised you the most today? Your body has been whispering. Now, you know how to listen. Before we end today's video, I want to remind you of something important. None of these signs mean you should panic. Your body isn't trying to scare you, it's trying to guide you. Every cold foot, every swollen ankle, every moment of leg weakness, every restless night, they're all signals. Signals that deserve attention, not fear. Your heart works tirelessly for you, every second of every day. And when it whispers for help, learning to listen can make all the difference. These signs don't mean something terrible is happening right now. Most of the time, they simply mean, this is the right moment to check in, the right moment to take steps sooner rather than later. And that is empowering, because the earlier you understand your body's messages, the more options you have to protect your health and preserve your independence for years, even decades to come. So if even one of these signs stood out to you today, just take note. Observe your body over the next few days. And if multiple signs felt familiar, that's a good reason to have a calm conversation with your doctor or healthcare provider. This isn't about fear. This is about awareness, about being proactive, and about giving yourself the care and attention you absolutely deserve. If this video helped bring clarity or reassurance, please support the channel by giving it a like. It really helps more people see helpful content like this. And if you'd like more doctor-style, calming health guidance for life after 50, go ahead and subscribe. We post new videos every week to help you stay informed, confident, and in control of your health. Now, I'd love to hear from you. Which sign surprised you the most? Or which healthy habit will you start this week? Your body has been whispering, and now you know how to listen.